Well, the reason that I think nature intended wisdom teeth to be a tooth that came in once we broke a few too many on gnawing on Tyrannosaurus bones or whatever we were eating as cavemen. So teeth tend to always drift forward. Okay, I think it was just nature's way for giving us some more teeth to chew with until we got eaten, probably. But the reality is we've outlived that usefulness, and so usually when it's time for the wisdom teeth to come in, there's just not enough room in the jaw for them to fully erupt in. Typically, what you'll see is, if this is the crown of the wisdom tooth, only this much of it being exposed in a patient's mouth because the rest of it's way back in the back of your jaw. So those are not cleansable by the patient, but because they are exposed, they're susceptible to tooth decay. You can still get a bad cavity on a tooth that's only 20% exposed and get a toothache from it and all the problems that go with it. So proactively, what we want to do is, if there's not enough room in the patient's mouth for the wisdom teeth to fully come in, then we're going to start talking about, at a fairly early age, removing them. You're right, wisdom teeth can get really long, gnarly, curly roots. So the goal would be to identify the patients at a young age that aren't going to have room for wisdom teeth, because teeth develop within your jaw. The first thing that develops is the crown of the tooth. After the crown, the part you can see develops, then the roots start to develop. So what you want to do is you want to get to those younger adults when they literally only have a crown of a wisdom tooth, maybe a little bit of a root developed, and they come out much easier. They're more shaped like a marble as opposed to a marble with some anchors on it. Okay? So the goal is get them out early, identify the patients that aren't going to be able to keep them because of the size of their jaw, and then get them done.